Hello, dear participants. Good morning, good afternoon, good evening, depending on where you are in the world. And welcome to our Hope and Homes for Children policy dialogue, No Sustainable Development Without Global Childcare Reform, Time to Commit to a Future Without Child Institutionalization. My name is Marie Raverdeau. I'm the EU and International Cooperation Advisor at Hope and Homes for Children, and I will be facilitating this session today. We will begin immediately. I will start with a few housekeeping rules. This meeting is going to be recorded. We will share the link to the recording to you all via email as well as on the Hope and Homes for Children's social media accounts. So you will be able to revisit this session and to share it widely. Throughout the session, you're going to be able to share your questions with our technical team, and we will address them to our panelists during the Q&A session. If we do not have time to share all of the answers, we will make sure to take note of your question and to share our answer with you after the session via the email address you registered with. Throughout the session, you'll also be able to share your impressions with our panelists by making use of the emoticons, so feel free to use that. For those of you who are unfamiliar with our work, Hope and Homes for Children is an international organization aiming to be a catalyst to end the institutionalization of children. We work with partner civil society organizations, funders, governments, in partnership with children, families, and communities to support the process of the transition from institutional to family-based care systems. And as we will discuss today, institutions deeply harm children. They are a symptom of a child protection system that is not working, and they perpetuate this deeply unsustainable system. Today's policy dialogue is organized at the occasion of the Summit of the Future. It's our contribution to the discussions that are going to be held and about what world we must leave to future generations. For those of you who haven't been following the Summit of the Future, the Summit of the Future is the main intergovernmental event this year on the progress around the Sustainable Development Goals. And there's going to be a negotiation, there has been a negotiation around three main outcomes: the Pact of the Future, the Declaration on Future Generations, and the Global Digital Compact. These policy documents are intending to outline UN member states' commitment to safeguard and deliver a better future for generations to come. And as you may already know, these outcomes are going to be adopted on 22nd and 23rd of September. So just a few words of background on this. At Hope and Homes for Children, we've been monitoring the drafting process of both the Pact for the Future and the Declaration on Future Generations. And we've strived to ensure that children deprived of family care are not left behind in these important documents. And while we welcome that children are included in both documents, we believe that there's much that remains to be done to clarify how the Pact for the Future in particular can support children across the world. So as part of our contribution for the Summit of the Future, we have shared some five key recommendations on how world leaders can champion global care reform. We're sharing these on the screen that you can see now. One, condemn child institutionalization and other forms of deprivation of family. Two, pursue an inclusive approach to social protection to prevent family separation and build community resilience. Three, set data collection mechanisms, evidence-based goals, and monitoring and evaluation systems to assess progress. Four, ensure the meaningful consultation of and accountability to children with care experience. And five, commit to systemic national child protection and care reform through sustained financing, including global financing mechanisms. So to these dates, an estimated 5.4 children who grow up in institutions around the globe. And as we've mentioned before, and we'll see later more into depth, a deeply harmful situation for these children. It's very well documented that institutions are dangerous environments for children to grow up, where they face violence, neglect, and abuse. And not only is child institutionalization a violation of children's rights, it is profoundly unsustainable for a multitude of reasons that we're going to see with our panelists momentarily. So all of these are the reasons for today's policy dialogue. And we're going to explore together why there can be no sustainable development without global childcare reform, and why it's time to commit to a future without child institutionalization. To let you know, this is the first of a series of events where across the upcoming year, we're going to organize a number of discussions centered around some key aspects of these urgent needs for child protection and care reform, and why it's time to commit to a future without child institutionalization. So back to today's discussion, we're going to start by hearing the powerful story of Muwiza, who is a young woman with disabilities from Rwanda. It's going to be a pre-recorded video in her own words of life in an institution, and crucially life after institutionalization, once she got reintegrated with her family. Every day, it's millions of children who go through the same struggles that Moiza faced in an institution. And at the same time, if world leaders commit now, we can ensure that these children, like Moiza, can experience the joy of living in a family again, and that no future child grows up in an institution. And following Moiza's story, we will be joined by our panelists, with Anju Pun, Adel-Anna Sasvari, Chris Muwanguzi, and Professor Van Ijzendoorn, with each of our panelists sharing their insights on the unsustainable nature of child institutionalization, and importantly, the way forward towards global childcare reform. Throughout today's panel, if you have any questions, again, please share them with us in the Q&A box, and we will have a Q&A session after the panel discussion. You also will be able to revisit today's session online, as well as access Moiza's video after the session. So, dear panelists, dear participants, thank you very much for joining us today, and let's turn our attention now to Moiza's story.
ubuzima bwo mu kigo ntabwo bwarari bwiza, haba mu kurya, haba kutubwira nabi, haba kwandika inzandiko batubeshyira ko turya ibintu kandi ntabyo tubona. Yego, wajya no kubaka wenda n'ikaramu yashize ugasanga akubwiye nabi. Ese bwarari ubuzima butoroshye, ntabwo twisanzuraga. Ube washaka kujya hanze cyangwa n'abandi baje kugusura ngo bumve babyakiye, batubwiraga nabi bakadutuka. Tukiba mu kigo uzi inzara yabaga irimo kandi ibiryo bitabuze, ariko ubuyobozi n'iki bigatuma batabitanga uko bikwiye, kuko hari n'ikintu cyagezweho tukajya twumva ko icyamba tukavamo. Mbese nta cyiza cyo mu kigo nabonye. Igihe twumvaga ko twasubira mu miryango yacu, twarabyakiriye cyane, turabyishimira, turavuga ati ibi byabaho. Numvishe ko ari ikintu kidasanzwe muri njyewe, avuga ati bungiye kongera kubana n'ababyeyi banjye. Byanshimishije cyane. Umuryango, hari igihe umuryango w'abana batoya ntabwo baba bazi umuntu, bakubonaga muri vakanse, bumwe bakagaruka barakwibagiwe, bakumva ko utanari uwabo, ariko ubuho bumvaga ko bafite ibyo bikanezeza cyane, kandi nabo bakanezerwa kubera tuba turi kumwe. Yego, icyo ngicyo cyaranejeje cyane cyane. Ariko kuba mu muryango bituma ugira wenda ikinyabupfura, ukibagirwa bya bindi wabonye, bakakwigisha umucyo, ukishima kandi ukishimana na barumuna bawe, ikintu kinyerekana ko bawunda. Gutyo iyo tugiye ku ishuri, kubera bari abasaza banjye banjyana, iyo batinzeho n'umunota iyo batinzeho nk'umunota bumagara papa cyangwa mama, ngababwira ati ko batinze kuza, bagahita bavuga ati turabakubita, barumirwa ahubwo. Ubwo rukundo rero ababyeyi baba bangaragariza kandi bakarutoza barumuna banjye, numva ari iby'agaciro. Ikintu nabwira ababyeyi bafite abana bafite ubumuga ni ukumenya ko n'abana bafite ubumuga nabo bafite uburenganzira bwo kuba mu muryango, wo kwitwarwaho. Nimba ari ukujya kwivuza, bakamenya ko nawe yatwaye agomba kwivuza, ntibamuheze. Nimba ari ukujya gusenga, nimba ari ukujya kwiga, kumva ko nimba afite ubumuga nawe hari icyo ashoboye kwiga, yego nawe bakamenya ko afite uburenganzira bwa muntu.
Wow, a very big thank you to Muiza for sharing her story, and also to our colleagues in Rwanda for facilitating this important video. I think this experience is really a fantastic start to our conversation. I think it brings us back to the reality behind the policies and the real impact of striving to reuniting children with families. It also gives us a strong indication of one of the most prevalent groups of children institutions, which is children with disabilities, and the importance of meaningfully working with them in designing and implementing measures to return them safely to family. And now I'd like to warmly welcome our fantastic panel. Today we're going to be joined by Anju Pun, Adel-Anna Sasvari, Muwanguzi, and Professor Marinus Van Ijzendoorn. And I'll just give a few words of introduction about our speakers. Anju Pun brings over 20 years of dedicated service in Nepal's development sector. She has devoted her career to dismantling systemic barriers that hinder human progress, focusing on enhancing systems that prioritize and respond to the most vulnerable children. Anju is passionately involved in systemic care reform in Nepal, and in strengthening community-owned alternative care to prevent child institutionalization, child trafficking, and family separation. And through her tireless efforts, she aims to contribute to a future where every child is loved, protected, valued, and given the opportunity to thrive. Thank you for joining us, Anju. Adel-Anna Sasvari is the Rights of the Child Policy Officer at Directorate General for International Partnerships at the European Commission. She's providing technical support to policy and program development to EU delegations in developing countries at headquarters. She also has an extensive background in humanitarian protection, including gender-based violence and child protection, and she's worked in several humanitarian crises across the world. Muwanguzi is CEO at Child's Eye Foundation in Uganda. Chris envisions a world where everyone, regardless of background, can reach their full potential. Through Child's Eye Foundation, he and a dedicated social workforce team work to build thriving and inclusive communities for children and their families. With other 2 decades of experience in social impact and international development, Chris provides strategic leadership to tackle inequity and injustice. Collaborating with governments, communities, and impact investors, he aims to address the root causes of social exclusion with the ultimate mission of creating a society where everyone has agencies and is valued. And finally, Professor Van Ijzendoorn is a honorary professor at the Faculty of Brain Sciences in University College London in the United Kingdom. He's also an adjunct professor at the Department of Psychiatry at the Monash University in Melbourne, Australia. He was one of the leaders of the Lancet Commission on Institutionalization and Deinstitutionalization, and he's coordinated a series of meta-analyses resulting in the Lancet Psychiatry paper on the issue. I want to say a big welcome to you all and thank you for joining us today. And we're going to start straight away with a question to Anju. So we've seen the powerful story of Muiza, and on the back of this video, I'd love to have you share with us the reality from a social worker's perspective, from a underground organization of supporting and protecting children with care experience, and how to safely ensure their return back to a loving family environment.
Thank you, Mary. Thank you for having me. Mawiza's powerful story, it reminded me of a 11-year-old girl we found in a torn and tattered wheelchair in an orphanage in Kathmandu. I was part of the government's rescue team, and I choked in that moment because that wheelchair and a few chickens around was all her life. We safely removed all 8 children from that orphanage and reintegrated them in families. Later, we came to know that the families were economically poor, schools not great, and the child with disability needed care and attention. But they were sold with false promises of better care, better lives, and better boarding schools in the orphanage. Hello everyone, my name is Anju Pun and I work for Forget Me Not in Nepal for over 10 years now. Forget Me Not is a small child protection organization in the country advocating for children's right to family, and we work through our partner NGO, the Himalayan Innovative Society. And the core work which we do here is to support government's deinstitutionalization efforts, to reduce the number of children in institutions and strengthening child protection system, building care reform strategies and alternative care in the country. The reasons of family separation and child institutionalization is very complex. We all know that, but I would like to again remind here, due to lack of quality education, poverty, unsupported single mothers, child marriage practices in indigenous communities, children born from socially discriminated community in the western part of Nepal, dysfunctional families, disabilities, migration, lack of awareness on psychological harms of child institutionalization and its long-term impact on the mental health of these young children. And to make it worse, disaster and emergencies like earthquake and COVID-19 pandemic are the main reasons of family separation and child institutionalization in my country. Our direct interventions and support to the government's effort has helped in closing 33 orphanages and have reunified 412 young children back to families with regular monitoring and family support to ensure their well-being and rebuilding their lost connections. What we are doing is we help these parents, families, and caregivers to cover education costs, providing meals and tiffin support, buying textbooks, uniforms, school fees sometimes, bicycles to cover the distance for the children to reach the schools, parenting and livelihood trainings to families, vocational trainings, and mentorship program for care experienced. And at the same time, also to build their access to government scheme, preventing more children from entering to institutions. These are the core work which we have been doing so far. But we know that our heart is in the communities. And what we are doing is we are working to preserve families by embracing and protecting our deeply rooted culture of love and humanity. We are demonstrating the power of community by implementing community-based practices like kinship care and foster care in in districts like Chitwan, with 2 municipalities in partnership with the authorities, so that we can build a strong gatekeeping mechanism in the community by the people there. And the core advocacy efforts we are doing it is all guided by 2 decades of our evidence and the voices of care experienced young people. We ask authorities for the implementation of the Children's Act, 16th periodic plan, which is just recently out in the country, and the 5 years action plan for children and integrated guidelines for alternative care for more budget and resource allocation, leaving no child in institutions. In last 5 years of our national data, we see a reduction of 28% of children in orphanages, but it is not enough. And there are still 11,000 children in institutions waiting to go home. And we cannot do this alone. So we joined our global care reform partner, Hope and Homes for Children, in January 2019. At the end, what I would like to say is that if the country has institutions, then it is a clear sign of failing our children. We are failing the SDGs. So it's high time to commit to a future without child institutionalization. And the need today is to listen to these young children and care experienced young people with stolen childhood and identity. And we stay accountable to that. Thank you.
Thank you very much, Anju, for this really comprehensive expose of the links between the factors that bring children institutions, that separate families, and the bigger picture, social cohesion picture, and how your organization and your partner organizations come in to make sure that children are durably able to remain in their families. I'd like to maybe switch to Professor Van Ijzendoorn. Marinus, could you please come in and comment on how this example in Nepal links and relates with the global picture and with global findings?
Yes, of course. Thank you for making me part of this wonderful event. I was very struck by Muiza's recount of her experiences in the institution. They are heartbreaking. She recounted emotional abuse, psychological abuse, continuous negative feedback, and also physical neglect with the provision of insufficient food, for example. The overarching characteristic of institutions like we studied in Ukraine, in Greece and India, other places, is structural neglect, kind of child maltreatment. These are total institutions, and not because of unmotivated professionals working there, but because of the structure of institutions. They are regulating group life for these children 24/7. Sleep, food, free time, peers, education. There's always centralized regulation of those activities and no personalized child rearing possible. And that also triggers, that type of institutionalized settings also triggers abuse. Even in a rich country like the Netherlands, we found, especially with youth with congenital neurodevelopmental issues, that there were higher rates of maltreatment prevalences in institutions than in foster families with comparable children involved. So we have to abolish institutions for children and youth, as they are out of step with modern times and evolutionary seem totally unique outliers. We are not evolved to be raised in institutionalized settings. And I want to quote Hermann Gemeiner: tear down your institutions. Abolish your institutions. That's what he asked for, the founder of SOS Children Villages, and I agree with him. Even in case of small institutions that still are structurally neglecting the children, as we recently showed, are detrimental to child development. And they also have been shown to trigger severe abuse. The alternative is clear from the research that has been done across the last 50, 60 years. Family-based child rearing, such as adoption, kafala, foster care, those are formidably effective child protection measures. And of course, before that transition, the replacement into the family of origin. And those families should be better supported than they were in the past. Tear down your institutions, start supporting families, alternative families and families of origin. That would be my message on the basis of 70 years of research.
And I think we're really, really grateful of you reminding us of these fantastic quotes, tear down your institutions. Thank you very much, Marinus. From your perspective, from an academic's perspective, can you tell us a little bit of what is known of child institutionalization, its root causes, and how it impedes sustainable development globally?
Yeah, unfortunately, my estimate of the number of children in institutions is 7.5 million. That's what I have been reading in Desmond's 2020 Lancet paper, formula, nice, great paper. And there's an increase being expected, even though there's this deinstitutionalization going on because of the aftermath of COVID. There's really a hidden pandemic going on with that of parents and of poverty of families that are not able to care anymore in many countries, many environments. 2.6 million children are expected to come into institutionalized settings if we don't act. And on top of that, there's wars raging. I don't have to remind you of wars in Africa, in Eastern Europe, Middle East, and they're creating biological orphans and poverty, of course. I think you can speculate about the root causes. It's difficult to pinpoint one, but certainly there's this economic push factor of poverty, the poverty that's being created in the majority world now already for ages through exploitation by the minority world. There's natural disasters, pandemics like HIV and COVID. And last but not least, ideologically, barriers to going into the transition to family life. It's in the NGOs, public and policy, still, or at least till recently, that institutions might save children, invest in physical bricks and stones instead of supporting families. And that's really counter the replicated and very firm fact. And Lancet Psychiatry, 2020, meta-analysis, 300 plus studies, 60 plus countries, 70 years of research, we found detrimental effects on physical growth, brain growth, cognitive development, socio-emotional development, large effect sizes, half the standard deviation to 1.5 standard deviation, especially in physical growth and head circumference, a crude indicator of brain development. There's an evidence-based solution as being emerging in our meta-analysis. That's the transition to family. It's really one of the most effective interventions ever in psychology and psychiatry. And we have to capitalize on that. And what it means is that we need triple S type of family life: safe, stable, shared care, family care. Safe, no maltreatment; stable, no disruptive separations; shared, multiple caregivers to support families. And in the Lancet recent in this summer, we argued that to monitor the change to deinstitutionalization, you don't have to count the inflow, stock or outflow number of children in institutionalized settings. What we argued was that deinstitutionalization indicators are very much more important for safety, maltreatment rates in alternative family settings, number of alternative care breakups, very important as indicator of stability, and the size of the supportive network around alternative family care and biological family care, shared care. So those are, I think, crucial indicators if we are wanting to be successful and monitor our success in deinstitutionalization.
Thank you very much, Marinus. I invite all of our participants that aren't too familiar with your work to visit your website, where they could find some really seminal publications. There's so much to unpack there, but I just want to pick on the very pertinent point that in this time of the current and the emerging crisis that we're going to face, family-based care is incredibly important. And we hear a lot in the sustainable development discussion that politicians, decision makers are focusing on the urgent issues. And we hear now that it is incredibly urgent to put into place systems where children are cared for in a family environment, especially when risking to face some really crucial challenges currently and in years to come. I'm going to switch now to Chris Muwanguzi. I think we've heard now with Muiza's video, with Anju's points, as well as Marinus's, that there is such a wealth of evidence and experience against child institutionalization, and that is well known by childcare reform advocates. And do you think that this message is cutting through, is reaching world leaders, and how can we make it even more prominent, particularly in these key global moments, such as the Summit of the Future?
Thank you, Marie, and thank you to all my colleagues that have spoken before me. And I really just want to highlight Muiza's story, which also left me with quite a few things to think about and reminders of why this work is really important. Look, the evidence against child institutionalization is well known amongst childcare reform advocates, but there's still a lot of work to do to ensure it's widespread into global action. And while key milestones like the 2019 UN General Assembly resolution on the rights of the child have drawn attention to the importance of family care and harmful effects of institutionalization, broader and sustained efforts are necessary for deeper reforms. I'll highlight one of them, the Kigali Declaration on Childcare and Protection Reform, which was endorsed at the Commonwealth in June 2022. Now, this is a significant step. It places family and children at the core of the Commonwealth's policy agenda and emphasizes the need for childcare and protection across all member states. The declaration highlights, as the professor has spoken about, that more than 5 million children globally live in institutions and are often unnecessarily separated from their families. Baroness Scotland also notes that children raised in institutions face disproportionate vulnerabilities that affect their development and future opportunities. Now, these points align with the global human rights frameworks, which recognize the challenges of institutionalization and the urgent need for transformation. There are also some other upcoming efforts, such as the 2024 Global Ministerial Conference against Children, Conference on Ending Violence Against Children in Bogota. This particular conference presents a crucial opportunity to raise awareness and prioritize institutionalization as a central issue in discussions on violence against children, but also in ensuring that we continue to connect the institutionalization with violence as well. Now, I'll talk about some other strategies very quickly. We need to do more, and one of those things is amplify the global advocacy message. So again, the ministerial conference is a great opportunity for us to do this. We need to strengthen regional and national efforts, regional declarations like the Kigali Declaration, and have many more in other regions, which can pressure national governments to align their childcare practices with international frameworks, such as the Convention on the Rights of the Child. Also demonstrating how institutionalization violates children's rights will help build this momentum. But here's something that has and has not been mentioned. We need to continue to link childcare reform with broader global agendas, such as education, health, and economic development. But I also think we should showcase the interactions between childcare reform and other development goals to make a compelling case to leaders in Africa and across the world. Now, where 1 in 3 children live in severe child food poverty, due to inequity, as well as conflict and climate crisis. We can also address the connection between inadequate care and environmental challenges. So the poorest nations of the global south, which have contributed the least to climate change, are expected to be impacted the most, particularly in Eastern and Southern Africa, which are among the worst affected regions. So Marie, integrating climate change into care reform will require strong focus in building community preparedness and resilience. In this way, inadequate care and climate change are mutually reinforcing. We must ensure that care is referenced in climate change adaptation and disaster risk reduction plans. Addressing climate change is no longer solely the responsibility of climate specialists. It will also become a primary responsibility for all those who work to promote children's well-being. And then finally, I think we need to leverage data and human impact. The emotional and economic arguments for ending institutionalization should be backed by data presented at forums like the United Nations Human Rights Council in 2025, but also human stories combined with robust data can shift global opinion and spark action. Thank you.
Thank you very much, Chris, also for linking the childcare reform movement and agenda with the sort of the wider conversation. I think one point that we'll need to work on is also to build bridges with those advocates as well, in particularly thinking about those major global events like the Summit of the Future, but also regional. And I think speaking of building bridges and talking to the wider stakeholder community, I'd love to give the floor to Adel. And Adel, hearing Chris's account on of how the care reform movement strives to work with world leaders, could you comment by sharing a little bit about how the EU strives to support and work more closely with childcare reform advocates in return, please?
Well, thank you very much, first of all, for the invitation to this panel. It's very interesting. I'm taking good notes of everything which has been shared. It is very interesting. And of course, I think one of the practical ways to engage with civil society on all of these reforms is organizing, raising the awareness among our colleagues, both in headquarters and in EU delegations, about the importance of this issue. And one of the ways how we engaged, for example, with Hopes and Home and Lumos in January last year, that we organized a capacity building session for our colleagues in 50 EU delegations, both from Directorate General International Partnerships, where I work, and also from the Directorate General Neighborhood and Enlargement, to raise the awareness about the importance of this issue, because I can say that somehow it is still remained in the corner, right? When we talk about human rights reforms or the rights of the child, or even when we are getting closer to violence against children, somehow the issue of deinstitutionalization is not so well known, I think. And I think one of the practical steps, how we can build bridges between like institutional donors and civil society and academia, is to support capacity building efforts, targeting directly those who are later involved in supporting reform programs.
Thank you very much. Indeed, very good point that we have been working with DG INPA in supporting EU delegations. For those of you not too familiar with the work of the EU, those are missions of the European Union across the world, supporting the EU policy commitments. And I will then just very briefly share, ask you, Adel, if you could also shine a light on some clear EU commitments made to support and protect children deprived of family care and champion the transition from institutional to family-based care systems, and how this commitment is translated into action. Thank you, Adel.
Hi, Marie, are you sharing the slide, the screen?
Yes, I imagine that our colleagues will share in a moment.
Okay. In the meantime, I just would like to add to that for those who are not familiar how we actually work. So at the European Commission, the Directorate General International Partnerships is basically working in a very decentralized way. We have 130 EU delegations worldwide in countries, and mostly we work bilaterally with governments. So while we have important programs managed here from Brussels, the lion's share of the activities and the programs are funded by our colleagues in these EU delegations, which are basically EU embassies, managing the development program portfolios. So in terms of important entry points, for supporting digitalization are mainly the EU delegation in the countries who are developing the national human rights, democracy strategies, and then with the respective envelopes, they are implementing what they consider a priority. And one of the most important probably points would be raising the profile of this topic among the priorities in the bilateral discussions with governments, also in terms of policy reforms, but also supporting economically with funding these types of activities. So now we can look at the very recent policy developments where the EU made a commitment to support the institutionalization and quality alternative care and transition from institutions to family and community-based care for children. As you can see, all the days, they are all very relevant, recent developments. We can start with the EU Action Plan on Human Rights and Democracy in 2020, covering until the end of this year, and it will be very probably extended. Then the EU Strategy on the Rights of the Child in 2021, using the same language, supporting quality alternative care and transition from institutional care to home-based and community-based care for children, and also children with disabilities. The Youth Action Plan in the EU External Action, which was adopted in 2021, makes a specific commitment to support capacity building for our colleagues in EU delegations and at headquarters regarding child protection. The strategy on the rights of persons with disabilities, which covers the period 2021 and 2023, is making a specific reference to old and young persons with disabilities, not only children, to have the right to be included into community. The very recently adopted EU guidelines in children and conflict makes a specific reference among the vulnerable groups, children in institutions or deprived of family care. And I really need to say that this text is in the guidelines basically exclusively because of Hoops and Home and the office in their office in Brussels for the relentless advocacy and the following this process of the drafting in these guidelines on children and armed conflict. And there is also a very recent development from April this year, which was the Commission recommendation on developing and strengthening integrated child protection systems in the best interest of the child, which has a very specific section and detailed recommendation regarding this transition. But as regards EU internal affairs, so it's more addressed to the member states and their childcare reforms in the respective countries. But all of these EU guidelines and strategies, they normally have a global dimension. And in this global dimension, it is mentioned to support an integrated approach to child protection and social protection without particularly mentioning the institutionalization. And last but not least, our most important instrument is the Neighborhood Development and International Cooperation Instrument, the Global Europe, which is the regulation which the main policy instrument for development cooperation, and the funding envelope. And as you can see, it has a very important envelope of 79.5 billion euros, covering both thematic and geographic actions. And there is a specific reference to the institutionalization under both thematic and geographic programs. So we have a very comprehensive policy environment to support the process. Of course, what comes next, how this will be translated into action.
Thank you.
Yeah.
Thank you, Adel. I imagine that you're going to continue with sharing with us a few concrete projects of the EU across the world on child protection and care reform.
Yes, indeed. So we had a package of 30 million euros, which funded this type of programs and processes in 5 countries, in Armenia, Burundi, Cambodia, Myanmar, and Georgia. Some of them has already ended, some of them are still running, but I'm happy to share some important results. For example, from the program implemented by Terre des Hommes in Myanmar, which received the support of almost 4 million euros. And for the moment, we can say that 2,600 children were removed from state-run institutional care, and which represented 89% of the newly identified cases and more than 70% of the average number of cases. And they managed to reduce to 57% of children in contact with the law they managed to reduce to 57% of children in contact with the law, those who are placed in institutional care, from the original 90%. So these are very important gains in terms of child protection. Another program, which is led by Save the Children in Cambodia, managed to reintegrate more than 300 children during the implementation period. And it had very, very important results considering prevention and strengthening of families, and they reached 38,000 beneficiaries, including girls, boys, women, and men, in terms of prevention activities. And here I can really relate to the previous speakers that prevention is a very complex issue. So it involves, because it should respond to individual needs or family needs, which can be very diverse. So this type of support can go from material support to counseling, to job placement, to mental health, to caregiver support, self-help groups, vocational training. It is a very comprehensive activity. And I think it's very interesting in this project that they included many qualitative indicators and many indicators related to children's perception. So it's very interesting that, for example, only, let me go back just a second, that 83% of the children did not feel that it was their decision to leave the institution. That although these are targeted programs and we're all aware of how important is ownership and participation, children agreed, most of them agreed with leaving the institutions, but they did not feel it was their decision. And it was also very interesting to have a follow-up on these reintegration processes, because, for example, almost 30% of the children at the end line, they did not feel that they were accepted in the communities. The indicators were very different. They scored very high on safety, feeling safe in the communities where they get integrated, but 30% of them did not feel actually accepted. So work around the stigma related to institutionalization, and like many interesting indicators and feedback came back from this program, which can then further inform like project design. And last but not least, the recently signed program in Rwanda, led by Hope Sent Home, which will particularly look at children with disabilities, and which has just started for 36 months, and we are really looking forward to the results.
Thank you very much, Adel. I think the point that you made on the crucial need to make sure that children are completely part of the process of reintegration is really, really important. That's part of our recommendations that we shared earlier in the discussion, the need to be accountable to those children that we aim to serve, and to ensure their meaningful consultation and participation as well. I'm going to thank you all panelists for this really, really interesting overview of all of your different areas of expertise. And I'm going to give the floor to my colleague, Stephen Usambe, Regional Advocacy Manager from Africa, for the questions and answer session. Stephen, up to you.
Thank you so much, Marie, and apologies for the technical issues that I've had. Quite horrible, but I'm here now. I can see that we have 2 questions, and one goes to Marinus. The question is, Marinus, is there any global data on the impact of institutionalization on communities? Many children have been in institutions. And the second question goes to Chris. I think this will give you a little bit of time to reflect. There are many urgent causes on the agenda for the Summit of the Future and other high-level intergovernmental summits. For example, climate change, peace and security, digital transition. How can we, as advocates, frame our message in a way that shows the urgency of acting for care reform? I don't know whether that's clear, Chris. Please nod if you had me right. Good, great, thank you. Marinus, I'll start with you. Thank you.
Yeah, sorry, Stephen. I would like to have you repeat at least part of the question, because I didn't really get the gist of it. So maybe you don't mind to just try and repeat it quickly, especially the first part. I didn't get it.
Sure. Is there any global data on the impact of the institutionalization on communities where many children have been in institutions?
So the other way around. It's from institutionalized settings and children included in institutions on the community instead of what we always study, the other way around, the community influence, the poverty of the community, the natural disasters that the communities are struggling with. So I don't think there's a lot of data, but it's a very, very intriguing question, because I always think that there's almost no phenomenon that's only one directional. It's always both ways at least. So there should be an influence of institutionalized children on the community around them. And I could, I could put forward some hypotheses, but I don't have data. One of the hypotheses would be that I think it would be possible that communities are strengthened as communities living together. It takes a village to raise a child. And I think that has been lost a bit. Also in African countries, I've been a regular visitor to Zambia, Kenya. I think it's unfortunate. I think maybe if deinstitutionalization is going to get forward, then there will be a potentially renewed type of this idea of takes a village to raise a child, because I think it's still a very important lesson that we learned way in the past from African communities. So that's my one hypothesis. I think it has a positive effect to strengthen the community feelings, but I don't have data on that. And the other thing is, I think really that the transition from institutionalized care to adulthood, young adulthood, is so critical for the youngsters, but also for the communities around them, to make that a fluent, a kind of a stable type of transition, so as not to create all kinds of problems with what we call in our discipline externalizing behavior, aggression, disobedience, malconduct. I think it's so important if that transition is going to be much more fluent from alternative family life type of care to communities, that the communities will be less burdened by bad behavior of the children who are going out of, or are care leavers who are going out of the system. So those type of influences might maybe potentially possible, but again, I don't have firm data on those.
Thank you, Professor Ijzendoorn. Please come in.
Thank you, Stephen. Now, I'm going to try and be quite succinct with this answer. In our strategy, our recent strategy, our 7-year strategy, Child's Eye, we describe this issue as an urgent civil rights issue of our time. So I think to kind of highlight urgency, I think one of the key things we need to do is use compelling data and statistics. So the evidence that, you know, Marinus is speaking about, the Lancet report, and so on and so forth. We need to highlight the intersection, as I've said already, of care reform with other critical issues, such as how institutionalization contributes to violence, poverty, and inequality. So SDG 1, 3, 4, I think 10, and even 16. Look, we just watched Muiza's story. A lot of people don't know this story. So we need to humanize this issue with really good personal stories and bring it home for a lot of people and remind people that it is an exclusion issue. It is a discriminating issue. And it is very much an issue, a civil rights issue. I think we need to frame institutionalization, in my opinion, as a global crisis. And we need to position child institutionalization as a form of violence. And I can't say that enough. We also need to show how institutionalization amplifies other global crises, such as poverty, inequality, and environmental vulnerability as well. There needs to be a focus on highlighting economic and social costs of inaction. It's expensive if we don't do something about this. And it's also expensive if we continue to institutionalize and remove children unnecessarily, as opposed to strengthening them globally. Even in the global north, it is more expensive to remove children. Again, we need to link care reform to national development goals, showcasing how family care can improve social stability and reduce poverty, and making it an essential investment for the future, aligned with SDG 1, and also 8, decent work and economic growth. And then I think, for me, the last two things is we need to set clear, time-bound targets for action. There needs to be a call for commitments from governments. We need to push for the adoption of specific measurable goals and deadlines on this issue. And lastly, for me, we need to align the broader global issue and events. I can't stop repeating that. And also try and just link care reform to urgent global issues, as well as leverage, I think, key moments, such as the upcoming global summit I've talked about on the violence against children. Something else that I didn't mention earlier on when I spoke, Stephen, is the UNCRC has just signed an MOU with the African Committee on Experts on the Rights and the Welfare of the Child. And I think there's a massive opportunity there for us to ensure that this issue in Africa is also a global example of how African practice-based examples can resolve a lot of these issues as well. The Global South has a lot of evidence to share, and it can contribute to solving these issues. Thanks.
Thank you so much, Chris. I can see we have more questions, but unfortunately we don't have enough time. But as promised, we're going to make sure that those questions are responded to. Please, Mason, and a colleague and a friend of mine, Frinko Manso, please bear with us on that. And guys, so we are approaching the end of our session and are looking towards the upcoming summit of the future, and crucially, how to ensure children's rights remain at the forefront of UN member states' priorities. I'd like to reiterate our 5 key asks, and I think Mari did share them. And the first one is really to condemn child institutionalization and other forms of deprivation of family, through an inclusive approach to social protection, to prevent family separation and build community resilience, set data collection mechanisms, evidence-based goals, and monitoring and evaluation systems to assess progress. Fourth one, to ensure meaningful consultation of and accountability to children with care experience. And last but not least, commit to systemic national child protection and care reform through sustained financial, including global financing mechanisms. Today, we have in particular delved into the need to condemn child institutionalization. I want to thank, on behalf of Open Homes for Children, our fantastic panel, as well as you all participants for your interest and participation. This session is the first of many, where we will be joined by key experts to explore the diverse aspects of the links between childcare reform and sustainable development. This session has been recorded, and you'll all be able to revisit or share the speakers' interventions online. We will make sure to invite you all to the next policy dialogues and hope that you'll stay tuned and continue to contribute to the conversation. Again, thank you so much.